Most patients experience only minor discomfort after the procedure. I do place local anesthesia prior to placing the implant, which greatly reduces the amount of pain postoperatively. You will have oral analgesia to go home with you to control your pain after the procedure. You will go home with a dressing on the site overnight. This will provide some compression to the surgical site. You will remove this dressing generally within 24 hours, after which time you should plan on spending several days resting at home. Elevation of the scrotum and cold packs, bags of frozen peas and whatnot make excellent ice packs to keep on the site, 30 minutes on, 30 minutes off for several days. I would also recommend avoiding any strenuous activity for 2 weeks after the procedure. After removing the dressing 24 hours after the procedure, you may shower the evening after surgery. The sutures are all dissolvable and will fall out on their own. So it's important just to let the soapy water run over you and pat dry with a towel. There's no need to scrub the incision or place any extra medications on the incision that may actually be irritating to the healing process. After the dressing is removed the day after surgery, it's important to feel the pump in the scrotum, and once or twice a day give a gentle tug downward so that pump heals in the most dependent portion of the scrotum, so you're easily able to find the pump and use it later. One common issue after surgery is constipation. The pain medication, along with changes in diet and mobility, can sometimes lead to constipation. You will go home with a stool softener to take twice a day after the procedure, but it's important to also eat a diet high in fiber and vegetables, as well as drink plenty of fluids after your procedure. If it's been a couple of days and you haven't had a bowel movement, I would recommend taking a shot glass full of milk of magnesia over the counter to relieve the constipation. You should plan to avoid lifting more than 20 pounds for 2 weeks after your procedure. You may shower 24 hours after your surgery, but I would like you to avoid sitting in a bathtub or a swimming pool or otherwise submerging your incision for at least 4 weeks after the procedure. In terms of activity, it's important to avoid any heavy strenuous activity for a couple weeks, including running, jumping, climbing on a ladder, etc. You may generally resume driving within a week after the procedure, after you're no longer taking opioid pain medication. You can return to light desk work within a week after the procedure. Some jobs may require up to 2 weeks off of work. The typical recovery period is 1 to 2 weeks after the procedure. You may resume light desk work generally a week after the surgery. I would, however, recommend no riding mowers or other strenuous activity for a couple of weeks. After surgery, please notify me should you develop a fever or foul-smelling drainage or worsening redness around the incision. It is normal to have a significant amount of swelling in the scrotal area and possibly even bruising. This should gradually improve day by day. However, if it is getting worse or you have concerns, please give me a call. When you go home from outpatient surgery, you will be scheduled for a post-operative visit with me within the next 2 to 3 weeks. You can start using your implant within 4 to 6 weeks after surgery. I will generally be seeing you in the office prior to then, and we'll set up an appointment at which time we can activate and teach you how to use the implant. If you have questions during the recovery process, please give my office a call and we'll be happy to talk to you about your concerns.